Hello and welcome. Doctors at the front line in medicine across the world face challenges because of coronavirus. But one segment of doctors which perhaps are continually exposed or likely to be exposed are dentists, who have to deal with patients increasingly and will deal with patients who are likely to obviously spread infection and therefore endanger their lives too. So the question that we're asking today is, how can my visit to a dentist be different? And more importantly, what are the precautions that I will have to take as someone who visits a dentist as well as a dentist who is likely to treat me? To discuss this, I'm joined by Dr. Vimal Arora, Chief Clinical Officer at Clove Dental, a chain of more than 342 clinics across India. Dr. Arora, thank you very much for joining us.
Hi, Govind. Thank you so much for inviting me.
Right. So tell us, I know that the Indian Dental Association put out some guidelines in the beginning. It had said it had prescribed certain precautions to take. Obviously, things have progressed now. This was in March. Now we are in May and reaching the end of the lockdown. And obviously, there are a lot of cases that are stacking up. Waiting to come to you. So what's going to happen, and how will patients be treated differently now, and what are the precautions doctors themselves are going to be taking?
So, Govind, that's very apt question, especially for the dentistry as a profession today, because on 20th of March, when this lockdown started, the clinics across the country closed down, and with that also came up the scare of the corona, which was communicated very well and appropriately by the media, and to bring about the right kind of information to the people, so that they could propagate the right kind of message of hand sanitation, of distancing, and managing the disease by staying away and meetings. So I think a very huge role of media was there at that time.
Right.
And the country could contain this spread of this disease to a very large effect by the a very large role by media, I'll say. Now, when all this has happened, the dentistry and the dental diseases, like disease doesn't stop by itself. They come to a standstill totally. And the problems were further compounded because they said that, this disease is much more vulnerable to be spread from the dental clinics. And what kind of direction should be available with the clinics, and how should they function? Now, we as when we are we have a responsibility to something like 40,000 patients, which we see every month, that how will we look after those 40,000 patients? So we issued our advisory on 24th of March, a detailed advisory based on the advisory issued by Ministry of Health and also by the Dental Council of India and the state dental councils. Because IDA's advisories are advisories, whereas the regulatory bodies, that is the dental councils,
right,
they are the regulatory bodies, so those are a guiding principle to be followed. Now, on those advices, we allowed our 1 to 2 clinics in each zone. So across the country, we opened 25 clinics to only take care of the emergency cases. And we defined the emergency cases. Yes, we defined that what will constitute the emergency. And we also defined that how will you carry out the treatments. Like we didn't tell them that, you can just go ahead with the treatment. We worked out how we will provide the treatment, which I will share with you. So now of late, as of a day before yesterday, Ministry of Health and Family Welfare has issued the final advisory, which is now a guiding principle over all dental councils and will also be obviously taken up by all dentists in the country. And they mentioned there very clearly that there are a lot of piecemeal guidelines coming up. So this will constitute and form a policy now for the whole of the country. Right. So that's how this. If you look at the background of this worked like this. Now let me share with you what we handled in Clove Dental in our clinics. Now, we came out with our advisory, which constituted 4 major components. One was readying up the premises. That means the clinics. So a total focus on the premises, that means the clinic, the operatories, the waiting rooms, the sterilization room, as well as the washroom. The second thing we took up was what kind of preparations we would like to do for the patient so that we have patient safety at the top. Third was what precautions can we take for the doctors and the staff so that our doctors are safe and there is no cross-contamination of the disease either from patient to the doctor or doctor to the patient. And lastly, we focused on the most recent technology and imbibing those technologies into our clinics with a view to have absolute sanitization, 100% sterilization, and asepsis in the clinics, which can give confidence to our doctors as well as patients that that the place is safe. If I come down, like you asked me, what would a patient would like to do before he goes to a dental clinic? You asked this question just now. Yes. Yeah. So Govind, like we came out with a very clear advisory for the patients also that what should you do? We have mentioned very clearly a 10-point agenda for the patients to do before they walk up to the dental clinic. Like we have advised them that you call up your doctor and fix up the time once again so that you don't have to wait, because social distancing has to be maintained. You should go to the clinic at the right time, or you should wait in your car. So reconfirm your appointment. Communicate to him about your treatment and what is the exact need so that the second visit can be avoided. Carry on with all your diagnosis or the X-rays or the OPGs or the CBCTs with you so that you don't have to get those diagnostic tests done again. Make sure that your doctor is fully aware of your medications which you have been taking, so that, God forbid, if you are taking, let's say, aspirin, and you haven't told the doctor, and when you go there, you go through all tests, and he says, oh, I'm sorry, you should have stopped this earlier. So things like this, you inform completely to your doctor. And lastly, on one side, you carry your own disinfectant with you, so that you disinfect your hand even when you're opening the door or you are climbing up the stairs and holding the rails, so that your hands are sanitized. Now, once you reach the clinic, then what a patient has to do is he should personally ask the doctor that what precautions he is taking against the spread of this particular scenario as far as he is concerned and his treatment is concerned. He should ask him, can he see it? He should see that what kind of protective clothings are being taken care of for the patient and for the doctor. So we have made the patient aware that you should.
So patients will also have to wear protective clothing when going on the dentist chair?
That's right. Because that's what is our advice, that patient PPE is separate and the doctor's PPE is separate.
Right, so that PPE is going to be provided by the clinic.
By the
obviously.
Clinic. Yes. And first you get your shoe covers, followed by gloves, by mask and the head cap. These 4 things are mandatory. And patient is given a povidone iodine 0.2% mouthwash so that the oral viral load is reduced tremendously. And then the patient is seated along with, his own drapable, disposable gowns, and the procedure can be started, whether it's a simple procedure of a diagnosis or treatment planning, or it's a minor procedure, which is
non-aerosol. Doctor, some of the points you mentioned would apply obviously to any visit to any doctor, arriving exactly on time, and of course the doctor's establishment also ensuring that, appointments are scheduled in a manner that a lot of people don't just come there and wait. And obviously, as you enter, you have to be more careful. So let me come to the other point now. The aerosol cloud, as which is clearly generated by patients who are on the chair, is perhaps the most dangerous thing that everyone has to watch out for. So do you have equipment for that?
Yeah. So, when you issue advisory, we also issue advisory that there are two types of procedures which you will carry out for the patients. One is aerosol generating procedures and non-aerosol generating procedures. So, in effect, the whole range of treatments have been classified into these two types of procedures, and they are done into different surgeries. So that you have one surgery where only aerosol generating treatments are done. So that surgery has special equipment, and that's one of the major parts of the special equipment is the high speed vacuum, which is a chair side vacuum, which is there to take care of the aerosol. So this high speed vacuum, once it takes care of the aerosol, then that air is passed through 5 filters, and then from a UV light chamber before that air is clean again. So if you say that, okay, like some of the clinics, they have said, I'll put a vacuum, operator there. That doesn't serve the purpose. That's only taking the vapor away from here and leaving it in a corner of the surgery so that the whole surgery becomes, full of vapors.
Right. So this is going to suck from my air. It's almost like an oxygen mask, but not on my face, right?
That's right. It is very close to the patient's face, and we can say it's about 23 to 30 centimeters distance. It sucks away the complete aerosol, whichever is generated there, and the doctor is already double masked. He is wearing N95. On top of that, a 3-layer surgical mask, and he is wearing his goggles and the shields. So he is completely protected, and aerosol is taken care of that. That aerosol passes through a cotton filter first, then it passes through a HEPA filter, then it goes through a carbon filter, then it goes through another filter which takes out the odor, and then it passes through a ionization chamber, right, and then finally through the UV chamber. So we have purchased these kind of aerosol extraction units and provided in our clinics so that our environment of the clinic is 100% safe. Yes.
So, and you're saying that all your clinics will have this, and therefore I'm hoping and assuming that all dental clinics everywhere will have this?
Yes. I think this will become a standard equipment across the whole country in all the clinics.
Okay. Okay. So, quick questions, Dr. Arora. So, one is that, what are the kind of pending cases, and how do you expect a crush when the lockdowns sort of start easing? Of course, they've started easing in some parts of the country, but I'm now referring to cities like Mumbai.
So, I don't have any presence in Bombay, but we do have a very large presence in Bangalore. Like, we are present in 26 cities across the country. So I can tell you about Bangalore, Hyderabad, Chennai, Delhi. So patients have started coming. And as the confidence is building up, once they come to the clinic and they see, oh, you have everything in place. So they are now coming back slowly to the clinics. But if you ask me, truly speaking, like I was seeing 40,000 patients every month earlier. When will we reach there? It all depends, what course the COVID takes over next months. But patients have started reaching out to us for seeking treatment.
Quick question. So what is the percentage of, let's say, patients who come for, ailments, I mean, dental ailments versus, let's say, cosmetic dentistry?
As on today?
Yeah. Traditionally.
Traditionally now, after, in the last I'll say about 15 days, about 80% are purely severe pain emergency cases. And only very few.
Normal times?
Normal times, we have a very large percentage. I'll say about 40 to 50% patients are seeking super specialty treatment. And a lot many more are seeking, the prophylactic treatment, that is preventive treatments, as well as the, cosmetic treatments. So then the percentage of emergency or pain related is smaller, say about 30%.
Right. So as you go ahead, I mean, for the next few months, what is the kind of, what conditions are you likely to see the most of, particularly conditions that have been, in a sense, held in abeyance for the last 60 days? And do you feel that cosmetic dentistry is likely to come down?
Yes, Govind, I definitely feel that the need for cosmetic dentistry is definitely going to be much, much, much lower for many months to come by, because it will be probably need-based treatment, or it will be repair of certain other treatments, or it will be continuation of some of the previous treatments. Those will be there, or the rehabilitative treatments will pick up. Definitely, I don't doubt that they will not pick up. But cosmetic treatments need will definitely come back. And one more thing I'll share with you here. Like if you look at, like I was looking at the, in the Twitter I was writing that Maulanas are they were seeing something like 7,500 sick report, and the dental sick report used to be 1,500 a day. Then if those dentist patients have not gone, then obviously with this lockdown, the whole lifestyle has changed. Dental diseases will come back with a vengeance, and we are going to be much, much, much busier in the times to come, looking after the emergencies, looking after the we are not going to we are going to be looking at the causative treatments, like which have happened because of this lockdown, because of your normal rhythm is broken, so you are not brushing anymore at the right time, you're not flossing, you're not interdental brushing your teeth, you're not taking care, your food habits have gone haywire because it's all stuck at home. So I think it's going to be a different kind of dentistry in the times to come.
Right. And conversely, these are the things you should be careful about if you're watching this, which is to obviously brush your teeth on time, floss them, and so on. Dr. Arora, thank you very much. We've run out of time completely. It was a pleasure talking to you. I do wish you and your team all the best in these very difficult times that lie ahead.
Thank you so much, Govind. Thank you. Nice talking to you. Thank you so much.